So again, we know that the brain needs a lot of blood for energy due to high need of ATP, but the blood can also carry a bunch of waste, things like toxins, antibodies, macrophages, other potentially harmful things that get into our bloodstream, like at our foot if you step on a nail or something. We wouldn't want those things to get into the brain. So that blood-brain barrier strictly regulates what gets into the bloodstream, into the tissue of the brain. So again, this is a picture of those astrocytes, the white astrocyte. And in this picture, the astrocytes are in close contact with the capillaries of the central nervous system. And those white processes that come off the astrocyte cover the outer surfaces of the endothelial cell. They release chemicals that control the permeability of the endothelium to various substances. So they kind of induce the endothelial cells to form the tight junctions that completely seal off gaps between them. So this ensures that anything leaving the blood must pass through the endothelial cell rather than between them. The endothelial cells are the cells themselves are more selective than the gaps are that exist between them. So just another picture of the blood-brain barrier, showing again the vessels, the cerebral vessels, and the astrocytes sitting on top of them. And again, you remember the connection between the astrocyte helping with blood supply to the neuron. The astrocyte, again, is that neuroglial cell. So it's very intricate in this blood-brain barrier. And the blood-brain barrier allows for diffusion of things that we need, things like glucose and oxygen and CO2. Things that I often need are caffeine. Sometimes we need anesthesia. Some folks have nicotine, but those are the types of things that are allowed to diffuse into across this blood-brain barrier. But again, if the blood-brain barrier is damaged, then harmful substances may affect that central nervous system. So again, when we talk about the blood-brain barrier, there are 2 points of entry that really need to be guarded. So the blood-brain barrier the brain barrier system includes both the blood-brain barrier as well as that blood CSF barrier, which we talked about earlier in the lecture. So the blood-brain barrier is the barrier that exists in the blood capillaries throughout the brain tissue. Again, the two major components of the blood-brain barrier are the endothelial cells, the tight junctions of the endothelial cells, as well as the astrocytes and their function in that blood-brain barrier. We also have that blood CSF, blood cerebrospinal fluid barrier, which we talked about earlier, and that's at the capillaries of the choroid plexus. So that's where the CSF, the cerebrospinal fluid, is made. And those endothelial cells, those specialized endothelial cells, are called the ependymal cells in the ventricles of the brain. So these two barrier systems that create the brain barrier system are critical, right? A really important safety mechanism to help us protect the brain. So what's the negative clinical side effect of this blood-brain barrier, or the brain barrier system? Well, the negative side effect is some drugs, medications can't cross that this brain barrier system. For example, when physicians are trying to treat Parkinson's disease, the docs, what medication does the doctor want to give you? Something that behaves like dopamine, right? To solve the Parkinson's syndrome. But these drugs can't cross the blood-brain barrier. So they had to come up with a metabolic precursor called L-DOPA. This precursor is a compound that can cross the blood-brain barrier, and then it undergoes a chemical reaction once it crosses the blood-brain barrier inside the brain, and then it converts dopamine to help the patient. So, researchers are working on, how can they intentionally, temporarily disrupt this blood-brain barrier to allow the delivery of medications across it. But But then we want the blood-brain barrier to work when it works, right? Because it's such a critical part of safety for the brain. But it also makes things a little difficult if we want certain medications to cross the barrier to be able to help patients. And remember when we talked about the choroid plexus and how there are sections where the cerebrospinal fluid is, the endothelial cells are really permeable, and their cerebrospinal fluid can be in close contact with neural tissue, and how that's really important because that allows the cerebrospinal fluid to be an indicator of when the nervous system is starting to fail. We also have parts where the blood-brain barrier allows the blood to be tested by the body near the hypothalamus and near the third and fourth ventricle, because we also want the body to be able to be aware of issues that are occurring in the bloodstream. So that's the end of the support system lecture. So there are 2 chapters in your textbook that cover both cerebrospinal fluid as well as the vascular system. And of course, the A&P books that we have and notes from previous A&P classes can also help with this review. See you next time.